Welcome to Copilot Podcasts. In just 1 year, AI use among doctors nearly doubled. That's right, from 38% to a whopping 70% of physicians now using AI tools. Today, we're diving into the American Medical Association's groundbreaking new guidelines for AI in medicine, what they mean for doctors, patients, and the future of healthcare.
And it's fascinating timing, really, because we're seeing this explosive growth in medical AI adoption right when we need these guidelines the most.
You know what's really interesting about this? The medical community is actually asking for more regulation. That's pretty unusual, right?
It really is. The AMA has been incredibly proactive here. They're saying, look, we need clear rules and standards before this technology gets too far ahead of us.
So what exactly are these new guidelines calling for?
Well, there are several key principles, but the biggest one is that physicians must be full partners in every stage of AI development, from design to deployment.
Every stage? What does that actually look like?
It means doctors need to be involved in the design, development, governance, rulemaking, standard setting, and even post-market surveillance. The AMA is very clear that clinical experts are uniquely qualified to judge whether an AI tool is valid for specific medical uses.
That's quite a shift from the typical tech development process.
Absolutely. And here's something interesting. The FDA has now approved over 800 AI-enabled medical devices. That's a huge number, and it shows why we need these guidelines.
800? That's way more than I expected.
And that's just the medical devices. There are many other AI applications in healthcare that fall outside FDA oversight.
What kind of applications are we talking about?
Things like administrative tools, documentation assistance, and various clinical support systems. Actually, that's where doctors see the most potential, in reducing administrative burdens.
I've heard about that. The numbers are pretty striking, right?
Yes, according to the AMA survey, 65% of physicians are most excited about AI's potential to reduce administrative work. Specifically, 54% mentioned documentation help, and 48% cited prior authorization assistance.
But there are concerns too, aren't there?
Definitely. About 41% of physicians are worried about patient privacy, and 39% are concerned about how AI might affect the doctor-patient relationship.
Those seem like pretty legitimate concerns.
They are, and that's exactly why transparency is such a big part of these guidelines. The AMA is insisting that AI tools be explainable. Doctors need to understand how these systems reach their conclusions.
What do you mean by explainable?
It means the AI can't just be a black box. Doctors need to be able to understand and explain to patients how the AI reached its recommendations or decisions.
That makes sense. You can't just trust a machine without understanding its reasoning.
Exactly. And the guidelines go further. They're calling for independent third-party verification of AI algorithms.
By whom?
Either regulatory agencies or medical societies. The key is that it needs to be independent from the companies developing the AI.
Let's talk about liability. That must be a huge concern for doctors.
It absolutely is. The AMA specifically addresses this in the guidelines, calling for appropriate apportionment of liability and protection for physicians from AI errors.
What does appropriate apportionment mean in practice?
It means that if an AI system makes a mistake, the liability shouldn't automatically fall on the doctor. The companies developing and deploying the AI need to share responsibility.
That seems fair. You can't expect doctors to take all the risk.
And it's interesting to look at how physician attitudes toward AI have evolved. The latest survey shows 35% are more excited than concerned about AI, up from 30% the previous year.
That's a pretty modest increase given how fast adoption is growing.
Well, remember that 41% say they're both equally excited and concerned. I think that shows a really balanced, realistic perspective.
What about training? These guidelines must address that, right?
Yes, they specifically call for mandatory training on AI tools, including regular updates as the technology evolves.
Regular updates, that's important given how fast this field is moving.
Exactly. And according to Dr. Margaret Lozovatsky at the AMA, technology is moving faster than implementation capabilities right now.
That must create some challenges.
It does, which is why the guidelines emphasize the need for a coordinated whole-government approach to regulation.
What does that mean exactly?
It means getting all relevant agencies involved, FDA, FTC, Health and Human Services, working together under a unified framework.
Because right now they're all operating separately?
Yes, and their authorities are limited. The FDA only oversees medical devices, for instance, while other AI applications fall into regulatory gaps.
That sounds like a recipe for confusion.
It is, and that's why the AMA is emphasizing that voluntary compliance isn't enough. They're calling for mandatory standards.
Let's talk about data privacy. That's a huge concern, right?
Absolutely. The guidelines require clear policies on how long AI-generated information and patient visit recordings will be retained.
That's something patients would definitely want to know about.
And they should know about it. The guidelines mandate transparency. Patients need to be informed when and how AI is being used in their care.
What about bias in AI systems? That's been a big issue in other fields.
The guidelines specifically address that, requiring evaluation of potential sources of inequity in both the problem formulation and the data used to train the AI.
Can you give an example of what that means?
Sure. If an AI system is trained primarily on data from one demographic group, it might not work as well for others. The guidelines require this kind of bias to be identified and addressed.
That's crucial for ensuring equitable healthcare.
And it's part of a broader emphasis on responsible AI development. The guidelines call for regular monitoring and updates to ensure AI systems remain accurate and unbiased over time.
What about the impact on medical education?
The guidelines address that too, emphasizing the need to equip medical trainees with skills to effectively communicate about AI use with patients.
That's going to be increasingly important.
Definitely. And it's part of maintaining that crucial doctor-patient relationship, even as AI becomes more prevalent in healthcare.
Speaking of relationships, how do these guidelines affect AI vendors?
They'll need to be much more transparent about their systems, including sharing information about training data and performance measurements.
That's quite a change from the usual tech industry approach.
It is, but healthcare is different. The stakes are simply too high to allow AI systems to operate as black boxes.
Let's talk about implementation. How quickly do organizations need to comply?
The AMA is encouraging organizations to start developing their AI policies now, but they recognize it's a complex process that takes time to do right.
What should organizations focus on first?
The guidelines recommend starting with clear definitions of AI-related terms and establishing governance structures for evaluating and approving AI tools.
That makes sense. You need to speak the same language before you can make rules.
Exactly. And organizations need to clearly define what uses of AI are permitted and what's prohibited.
As we wrap up, what's the biggest takeaway from these guidelines?
I think it's the recognition that AI in healthcare requires a different approach than AI in other industries. The focus on physician involvement, transparency, and patient protection really sets these guidelines apart.
And it's coming at a crucial time, with AI adoption growing so rapidly.
Exactly. These guidelines aren't just about managing risks, they're about ensuring AI actually delivers on its promise to improve healthcare.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, when it comes to AI in medicine, it's not just about what the technology can do, it's about doing it right. Thanks for listening.